panel, Danielle Ledoux and Sylvia Yu.
Hi, I'm Danielle Ledoux.
Hi.
I'll start. Sylvia, I believe, is also on the virtual testimony. So thank you so much for giving me the opportunity to present oral testimony in strong support of House Bill 1177, an act relative to defining invasive surgical procedures. So I'm a pediatric ophthalmologist. I'm a board certified ophthalmologist in the Commonwealth, 15 years at Boston Children's, and I began a practice up on the North Shore called Specialized Pediatric Eye Care. The idea in founding our practice was optometric and ophthalmologic care delivered in a manner that was clear so that patients coming in calling for an appointment could be appropriately directed in order to have the safest and fullest element of eye care and vision services provided. Because there's a lot of confusion amongst all of us when we receive our healthcare about the different degrees, the training, and the credentialing of different healthcare providers, this would help ensure that there's better, more clear-cut definitions and transparency for the safety of the people of the Commonwealth. Our practice sought to do this from the beginning, where it is hard to know exactly what it is different providers are trained in, are educated in, and what extensive amount of experience they might have had or not had when they say something is recommended. We want to clear the air and make it understood amongst our patients and families that are trying to get their loved ones the correct care for their child's needs or their own needs. And we think this straightforward definitions will help in really setting up safeguards, particularly as it relates to surgical care within the Commonwealth. I'm happy to provide any answers to any questions that anyone has, and I will submit my testimony as well later.
Thank you. Sylvia, are you here?
Hi, I'm here. Good morning, Chair Friedman, Chair Lawin, and members of the Healthcare Financing Committee. My name is Sylvia Yu. I'm also a pediatric ophthalmologist at Tufts Medical Center. We're both here to testify on behalf of the Massachusetts Society of Eye Physicians and Surgeons. We represent over 300 ophthalmologists in the Commonwealth. And I'm also a board certified ophthalmologist. I practice, again, at Tufts Medical Center, both in Boston and in Framingham. I completed medical school at the University of Alabama in Birmingham, residency at UCLA, and fellowship at Johns Hopkins. And I'm here to ask for your support for House Bill 1177, an act relative to defining invasive surgical procedures. Just going back a couple of years, I want to thank all of you for enacting the landmark healthcare bill, Senate Bill 2984, during the height of the COVID-19 pandemic to ensure coverage of COVID-19 testing and treatment, as well as telehealth services for the people of the Commonwealth. This healthcare bill included provisions to update the practice of optometry in our state, as was mentioned, in Massachusetts General Laws, Chapter 112, Section 66B and 66C, where ambiguous language left the meaning of, quote, invasive surgical procedures unanswered. House Bill 1177 would clarify this language and define the term invasive surgical procedures, which is not otherwise defined by Massachusetts law. This definition of surgery is consistent with the definition drafted by the American Medical Association and American College of Surgeons. And by including a definition of invasive surgical procedures, it ensures patient safeguards for eye surgery are protected. Without these safeguards, the quality of care for Massachusetts undergoing eye surgery in Massachusetts are at risk. And by defining invasive surgical procedures, House Bill 1177 does not take away from current optometric practice. Rather, it provides clarity and safeguards for patients needing eye surgeries in the future. The truth is, all surgeries are invasive. Surgery alters tissue predictably but irreversibly to diagnose and treat disease by the incision or destruction of tissue. And we want to understand that surgery does include laser surgery, and surgical risks are not eliminated by using a laser instead of a blade. And no matter how it is worded, non-invasive surgery does not exist, as was mentioned in the bill that I mentioned for COVID-19. And there are no shortcuts for learning how to safely perform surgery. House Bill 1177 would protect the eyes of the people of Massachusetts and provide assurances that their eye surgeries are safely performed by ophthalmologists who have completed rigorous and dedicated clinical training, which provides not only the necessary skills and experience, but also instills the judgment to determine when the surgery is needed and prepares ophthalmologists to be aware of and respond to surgical complications that may arise. Physicians and surgeons are held to high standards by the Massachusetts Board of Registration in Medicine to ensure the safety and quality of care that patients deserve and respect. On behalf of the Massachusetts Society of Eye Physicians and Surgeons, I urge you to ensure continued safe eye health care in Massachusetts by giving House Bill 1177 a favorable report. It is our professional and ethical responsibility to ensure patients receive surgical care of the highest quality from properly trained physicians and surgeons. And we look forward to working with you to uphold our state's high standard of patient safety. It is our collective duty to do everything we can to protect the eyes and vision of the people of Massachusetts. Thank you for your time and attention, and we're happy to answer any questions.
Just wondering, we made this change in 2020, so 21, 22, 23. Have we seen issues, problems, degradations because of the current language?
I haven't, I know of other states where there have been concerns. I haven't heard of anything in Massachusetts, but I would say it's been a pretty short period to know of any potential issues so far.
3 years isn't, so we usually do things in 3 to 5 year chunks. So, okay, but that's good to know, thanks. Any other questions, Okay, thank you so much.
Thank you.
Okay.